Medical Center, and I'm going to introduce this software, Swift MR, and how it's used in clinical practice and some of the research going on. The diagnostic MRI has shown a major breakthrough from the 2000s with the introduction of pre-Tesla MRI, and in 2018, the 7 Tesla scanner was approved for clinical use, but its use has been quite limited to mostly very narrow neurodegenerative diseases. So there seems to be a gap between pre-Tesla and 7 Tesla scanners, which I think can be filled by the deep learning reconstruction technique that's become widely available from 2020. So radiologists may not realize how the MR image quality evolves over time because we are so used to it. But these brain MRI taken in 2023 seem quite usual, nothing fancy or outstanding. However, if we look back, the MRI of the same patient taken in 2008, the radiologists will appreciate how much MR image quality has evolved. So it is well known that radiologists often have to decide between scan time and image quality. It has not been possible to have both until the AIRS Swift MR has been introduced in the brain MRI. With Swift MR, both image quality and scan time reduction can be acquired. And what's more, Swift MR can be applied in all main MR sequences, including T1 weighted image, T2 FLAIR, SWI, DWI ADC, and 3D2 fMRI. And in all major MR manufacturers, including Siemens, GE, and Philips, and more. So I'll give you a series of images here. This is 2D T1 weighted image. The standard scan takes about 2 minutes and 20 seconds. And the accelerated image reduces the scan time by a minute. But if you notice closely, there's a subtle increase in noise in the center areas of the brain. With Swift MR reconstruction, the image quality improves so that it matches that of the standard image. So overall, there's 43% scan time reduction with equal or better image quality. Similarly, for 2D T2 weighted image, the standard scan time is about 2 minutes and 22 seconds. Acceleration image is about a minute shorter. With Swift MR reconstruction, the image is similar or better than the standard scan. With the overall, the gain is 51% scan time reduction. This is for FLAIR. The standard image takes about 2 minutes and a half. Accelerated scan, as you can see, there's much noise in the white matter. With Swift MR reconstruction, the noise is gone, and to me, this image is even better than the standard image. So there's a 33% scan time reduction for this one. This is 3D2 MPRH. The standard scan takes about 5 minutes. The accelerated image is taken in about half the time of the standard image. After Swift MR reconstruction, the image gets has improved much better than the accelerated one. So there's 43% scan time reduction for this. So CSMPRH is a highly accelerated 3D T1 weighted image with acquisition time of less than 2 minutes, but at the cost of image quality degradation. After Swift MR reconstruction, the image quality improves substantially with added benefit of sub-millimeter spatial resolution. So I will introduce some of the images of DWI and ADC. The left is the conventional image taken with B1000, B value of 1000. There is an acute infarct in the left periventricular white matter. After Swift MR reconstruction, the margin of the lesion is much clearer. And it's repeated in the ADC map where the dark signal intensity in the left frontal white matter is very well visible. About this one has a short scan time of 34 seconds. It's DWI image, and there is an acute infarct in the right MCA vascular territory, and the gyro hyperintensity is very well visualized after Swift MRI reconstruction. It's less blurry, and similarly for the ADC map, the blurry margins are gone, and it's much sharper. Look much sharper on the ADC after reconstruction. Now it's interesting because these two scans are not taken in the same parameter settings. The conventional one has a distortion artifact in the frontal sinus area. After Swift MR reconstruction, with some parameter adjustment, there is a reduction of the noise in the frontal sinus. This is DWA taken in a fast acquisition way. There is a reduction of scan time by a minute, but there's an improvement of the noise in the image. So this one was interesting because can you see the difference between the two images other than the scan time reduction? This is a common artifact that looks like a stenosis in right petrous ICA. The artifact is gone after Swift MR reconstruction. So I'm going to introduce some research that's ongoing with using Swift MR. This is a patient with hippocampal sclerosis. The image in the right shows that hippocampal striation is better visualized after the Swift MR reconstruction. The upper image is the standard MRI. Both hippocampal tails show normal volume and internal structure. After the reconstruction, the signal intensity looks more increased, and the blurred hippocampal striation is more visible in both hippocampal tails. So what it means is that after reconstruction, the lesion detection is improved. These are images of T1 MP range after free surfer-generated cortical parcellation. So the green line is the line parcellated after deep learning reconstruction. So when zoomed in, the cortical parcellation is more accurate after reconstruction. As you can see, the green lines are well in line with the cortex, while the red lines are kind of cut, and there's some islands here. So it's not as accurate as the after reconstruction. So these images show the impact of noise on perivascular space segmentation. So this is T1 weighted MP range, conventional. The deep learning segmentation model produces these colored dots which indicate perivascular space. After reconstruction, the noise has improved, and the number of the colored dots, the perivascular space, decreased. So meaning that much of the segmentations were wrongly placed on noise. So these are box plots of perivascular space volumes. An experienced radiologist graded perivascular volume into mild, moderate, or severe. The green box plots indicate perivascular space volume produced after the reconstruction. So as you can see, the variability is less than that of the conventional segmentation outputs. So meaning that deep learning reconstruction produces more consistent outputs by the deep learning model. So these are publications that are using AIRS SwiftMR. So they published this earlier this year. The software improved the 3D high resolution T1 weighted MP range, and all image quality parameters improved. The fine structure delineation was also better than the standard. and the lesion consequently also better. So in this case, 59-year-old male with cerebellar tumor is a standard MPH. You can see that there is blurred mass and there's some peritumor edema. It's not clearly depicted. After the reconstruction, the tumors and the peritumor edema are much better delineated. As a patient with multiple sclerosis, you can see there's a MS plots scattered around the juxtacortical white matter. You can see after the reconstruction, the margins of the plots are much better visualized. Similarly, for vessel wall imaging, this is standard MPH. There's much noise in the central area in the circle willis and vertebrovascular artery. After Swift MRI reconstruction, the walls of the vessels are much more visible. And two independent radiologists rated image quality in these parameters, including overall image quality, perceived SNR, contrast, sharpness, and artifacts. And the Swift MRI reconstruction images had significantly higher ratings than the standard image in all parameters. Similarly, for fine structural delineation, the Swift MRI recon images had significantly higher ratings than the conventional one. So this is another study that used Swift MR on accelerated MR protocol in the lumbar spine MRI. So what they found was that there was a reduction of scan time by 32.3%, and the image quality was similar or better in both quantitative or qualitative measures. And same for the fine structural delineation was similar or better than the standard image. So this is the sagittal T1 weighted image of the lumbar spine. There's a moderate neuroforaminal stenosis at L5 and S1 level, which is well visualized on Swift MR reconstruction image. This is low denoise, so the setting is that there's a concern that, well, what if there's too much denoising that might blur the structures? Not true. If you look at the high denoise image, the stenosis is visible, and the tiny surrounding structures are maintained. In the axial T2 weighted image of the lumbar spine, the bulging disc at L4-5 level and cauda equina are well depicted. In the low denoise setting, the cauda equina are much better visualized. Like I can see the bundles here, and similarly in the high denoise setting. So overall, this protocol reduced the acquisition time by 30% and provided similar, or I think better, image quality than the standard image, and improved the lesion detection. So in summary, Swift MR can provide all these benefits: improve the image quality, lesion detection, and reduce scan time, and clinical neuroradiology. So what it can do is that this can maximize the potential of the existing scanner. So instead of purchasing a new MR scan with the software, you can improve the efficiency of the existing MR scanner, which will make the administration happy and most radiologists happy. Thank you for listening.